A common dysfunction is a facet lock at L3-4. With the patient in a side-lying position, we assess quality and quantity of motion using flexion and extension, which can be reinforced as and when necessary. For the purposes of this demonstration, we will assume somatic dysfunction at L3-4. With the patient side-lying, the operator stands in front and flexes the patient's legs until the interspinous space between L3-4 is palpable. We then straighten the patient's lower leg. The upper leg, with the knee flexed at approximately 90 degrees to aid stability, is hooked over the ankle, over the mid-calf. We flex and rotate the patient's torso anteriorly by drawing the lower arm until you palpate flexion and rotation at L3. We introduce side bending by pulling the patient's arm towards the patient's head until the forces are focused at L3-4. We then ask the patient to hold the opposite wrist. Now place the caudad forearm over the area inferior to the iliac crest, called the osteopathic sulcus. Then place the cephalad forearm in the patient's uppermost axilla. With the forces localized at L3-4, they are maximized and palpable under the finger pads. Have the patient breathe in and exhale, taking up the tissue slack and localizing your forces on end exhalation. Perform a higher velocity thrust with your lower forearm towards your knees by momentarily dropping your body weight, thereby rotating the lumbar region left and side bending right through L3. Although your upper arm mainly serves as a stabilizing force, it may simultaneously add a component of left rotation and right side bending. Retest the range and quality of motion following the manipulation.